Hello, my name is Heather Barnes. I'm a physical therapist with Ortho Virginia, and I will be discussing iliotibial band friction syndrome. The iliotibial band, or the IT band for short, the syndrome is actually a chronic inflammation of the IT band near its insertion point next to the femoral condyle. The IT band is actually a tendon, not a muscle, and it runs along the outside of the leg. It attaches from the top of the pelvic bone and runs down and attaches just below the knee. It's actually the most common injury in runners and cyclists, and it's the bending of the knee repeatedly that causes the friction at the tendon near its insertion point. Pain's usually reported at the region just lateral to the knee and occurs with this activity. So other symptoms some patients may notice include mild pain at the beginning of the exercise that may or may not decrease as they warm up, progressively worsening pain over time, and then pain with running, especially running downhill or even sitting for long periods of time with the knees bent. Some treatment will include some special testing performed by the physical therapist or the physician, and they will determine if your IT band is actually tight. Some pain relievers and ice will often be prescribed, and in some cases a cortisone injection may be necessary. In severe cases, surgical removal of part of the IT band can also occur. For the most part, patients will often work with a physical therapist, and they will be instructed in appropriate activity modifications, such as cycling or running shorter distances in the beginning, and in some cases avoiding the activity altogether. Stretching and strengthening of the appropriate areas around the hip and the lower extremity will be prescribed by the physical therapist, and the physical therapist may even change the way the patient is exercising to avoid exacerbation of the symptoms. Sometimes orthotics are even recommended. Ultimately, through a catered exercise routine specific for the patient's needs, the patient will gradually begin activity again, slowly restoring distance and speed and returning to their prior level of function.